You are in the Injury and Violence Prevention Center Research to Practice webinar. And we're very pleased to be here today to learn about implementing community level strategies to prevent violence. So hearing more about the impact of Denver's Youth Violence Prevention Center with Beverly Kingston and Sabrina Arredondo Mattson. I'll introduce them in just a moment. But this is a regular monthly seminar series that happens through the Injury Center. So we're very glad that you're all here today. And as you join, why don't you type in the chat your name and organization, just so we know who's listening, where you're coming from. I want to let you know that next month's seminar will be hybrid, so it'll be available in person on the Anschutz Medical Campus and also available by Zoom if that is your preference. We're going to have a visiting scholar presenting on the development and implementation of a tribal-led injury prevention intervention for older Maori in New Zealand. Her name is Joanna Hikaka. We're very excited for that session. I'll pop a link in the chat if you'd like to register for that, or you can join, like I said, in person in the Ben Nighthorse Campbell Native Health Building on the Anschutz campus on September 13th. So mark your calendar for that. And now I'd like to go ahead and introduce today's speakers. So we have Beverly Kingston. Beverly is the Director and Senior Research Associate at the Center for the Study and Prevention of Violence at the University of Colorado Boulder. And her research focuses on addressing the root causes of violence by creating the conditions that support healthy human development throughout the life course. And then we also have Dr. Sabrina Arredondo Mattson. She has extensive experience working with community-based organizations, grant-making foundations, justice systems, cities, schools, and programs on a variety of evaluation projects, technical assistance needs, and multicultural issues. And she currently serves as the co-PI of several projects that aim to implement effective programs and strategies for violence prevention. So thank you both so much for being here. I'm going to turn the floor over to Beverly to get us started. And if you have questions, feel free to pop those in the chat, and then we'll have time at the end for Q&A, so you can also at the end come off mute and ask your questions. All right, Beverly.
All right, well, welcome everyone. Really glad to be here and very excited to present on our preliminary results from our Youth Violence Prevention Center Denver project that ran from 2016 to 2021. And on this slide, you'll also see, besides Dr. Sabrina Arredondo Mattson, my other co-investigators are Dr. David Huizinga and Dr. Eric Siegel. And then our project director for this project is Dave Beckhofer. And then we want to just give a big thank you to our community partners and our whole project team, which has been extensive and incredibly wonderful. So here is our acknowledgement about our funding coming from the Centers for Disease Control and Prevention. So I want to give you a little bit of background about the Youth Violence Prevention Centers that the CDC funds. And they're called CDC's National Centers of Excellence in Youth Violence Prevention. And they began over 20 years ago, right after Columbine. And what they are they're academic community collaborations that are focused on advancing the science and the practice of youth violence prevention. Our center is one of 5 national centers across the nation, and each round of 5-year funding, so they all always have so far have lasted 5 years, has a different focus. And the focus of this 5 years is on community level prevention strategies. And the idea here is that prevention strategies at the community level have the potential to reach a lot of people, and they may be more cost effective and sustainable than individual and relationship level strategies. But what the CDC and the research shows is that there's quite a bit of gap in evidence about effective approaches to reduce community level risk factors for youth violence. So that's what this project is all about. And our project, our overall purpose is to implement and evaluate a community level prevention system that delivers community and policy level strategies that are matched to the local community's needs. And our overall outcome goal is to reduce youth violence among 10 to 24-year-olds in 2 Denver communities. So we selected 2 Denver communities that had high rates of youth violence, and their rates of youth violence were higher than the national average. That was a requirement for selection from the CDC. And then in addition to that, we wanted to make sure that the neighborhoods also had somewhat of an active neighborhood organization that would agree to participate in the project. And so the 2 neighborhoods that participated in this project were both part of our first Youth Violence Prevention Center that ran from 2011 to 2016. So neighborhood A was our intervention neighborhood, and neighborhood B was the matched comparison neighborhood in that first study. And we have made the decision to keep the intervention neighborhoods confidential throughout this presentation. So we wanted to protect their identity. But I'll give you some descriptive information about both of the neighborhoods. So in neighborhood A, it's just over 36,000 or almost 37,000 people. In neighborhood B, nearly 10,000 people. Both communities are predominantly communities of color based on the census data. And they both have at least 19% of families that live in poverty. In our first round of CDC funding, we did a community survey where we surveyed youth and families in the household. And we learned in that survey that in neighborhood A, 38% of the families were exposed to violence. And in neighborhood B, that number is 58%. So this slide goes through our project aims, and aim 1 focuses on the implementation of CTC, or Communities That Care, which is a multi-component community level prevention system. And we do that intervention in, like I said, in 2 different Denver communities. Aim 2, we conduct a implementation process evaluation to study readiness and capacity and how community level prevention systems actually function. So this is all, aim 2 is all about the process evaluation. And aim 3 actually studies the impact of the Communities That Care prevention system on neighborhood social processes. And aim 4 describes our outcome evaluation, which evaluates the impact of this community level prevention system on youth violence rates. So the next set of slides, I'm going to describe our methodology for the project. And I'm going to start with our theory of change. So the top box, like the big chunk of boxes, describes that overarching community level prevention system. And as I shared, both neighborhoods implemented Communities That Care. And Communities That Care is a 5-phased evidence-based strategic planning process. And as part of that 5-phase process, community stakeholders and key decision makers come together, and they form boards that guide the decision-making and planning of the community's processes. And the boards use data to develop a community profile. And then from that profile, they identify their community's top risk and protective factors that they want to address. And then they create a community action plan that actually is about implementing strategies to address those risk and protective factors that they prioritize. And they focus on using implementation science and then different evaluation tools to make sure that their plan's working. So it's a circle, it's a cycle, and I know it's too small to read, but that's basically the different phases. And in our project, so we said we're going to implement those 5 phases, and then we hypothesized that if we implemented those 5 phases effectively, we would positively impact the community's readiness and capacity to build a prevention infrastructure. We conceptualize that infrastructure as a high functioning high functioning community and key leader boards that actually support the careful selection and implementation of community level prevention strategies that are matched to the needs of the community. And in our, you'll hear a little bit more, we also have a policy level strategy that's a violence risk screening tool. And this overall infrastructure, which is all the boxes on the top, is expected to strengthen community social processes. This is the part I get really excited about because we don't know very much about these social processes. But some examples of community social processes are collective efficacy, which is like the willingness to intervene on behalf of your community, healthy relationships, and stronger institutional resources. And the idea is that if we have those stronger social processes, that will in turn lead to reductions in youth violence. And which social processes are influenced is likely to depend on the community level prevention strategies that each community chose to implement. So now I'm going to tell you some about those. Okay, so this goes back to aim 1, which is all about the implementation of that prevention infrastructure, those community level strategies. And so following the CTC process, the coalitions in the 2 neighborhoods examined neighborhood data. So they used the survey data that we had collected in the prior Youth Violence Prevention Center. And and that was, like I said, from youth and parents, and they prioritized their top risk and protective factors. And so, from a list of probably 30 different risk and protective factors, these are what they wanted to hone in and focus on in their communities. And so then from there, just gets to there. So then these are the selected strategies. So what they did is from there, they came together and they selected strategies that had some research evidence that, that they'd be effective, but they basically designed their strategies to match their community needs and to fit within their communities. So it's a very tailored approach. And here's the strategies. So just move this bar. So both communities came together and developed a joint youth-led social media campaign that's called the Power of One. And activities for the campaign included digital advertising and virtual and live events. Community A, in addition to that, they hosted or created a mini grant program that supported a variety of youth serving organizations, and they aimed to enhance the capacity of those organizations and to increase collaboration across those organizations. In Neighborhood A, they also developed a positive recognition campaign to recognize both youth and community members that made positive contributions to their community. In Neighborhood B, the Power of One campaign is a joint campaign, so they did that together. But in addition to that, they also did a community-wide social emotional learning project. And it's a really cool project where they basically aim to saturate their community with social emotional learning. And they started by implementing an evidence-based program called PATHS, which is promoting alternative thinking strategies in 3 elementary schools. And then they took the PATHS curriculum, worked with the developer, and modified it so that it could be implemented in the community context. And then in addition to those selected strategies, both communities implemented the social development strategy. And the social development strategy is something that is a component of communities that care. Basically, it's a framework that's based on research that says if you provide youth with skills, pro-social opportunities, and recognition for implementing those skills and acting on those opportunities, that they'll develop pro-social bonds. And those bonds become protective and support healthy youth development. The other strategy that we implemented across both projects and actually all throughout Denver is the Violence, Injury Protection and Risk Screen. And this is a screening tool that was developed by Dr. Eric Siegel, our co-investigator, and we've been implementing this in our projects since 2011. In this grant, well, I'll tell you a little bit more about that later, but basically this tool predicts if a youth is likely to perpetrate violence in the next 12 months, and that youth that score high on the screening can then be referred to programs for supports. So just here's a few photos of the Power of One campaign and the logo that the youth developed. A photo of the PAS community program and some photos from the different activities and some of our mini grantees. And this slide describes our implementation process evaluation methods. So this is aim 2. So these are all the methodologies that we put into place for our process evaluation and for each of our community level strategies. And you can also see which risk and protective factors each of the strategies are targeting. And our process evaluation measures focus mostly on participation, quality of delivery, and participant responsiveness. And this is our process evaluation methods for communities that care. So here we use an online coalition survey that were given to both the community and key leader board members at 3 time points. And this survey measured readiness, coalition functioning, and the CTC implementation. And our response rates ranged from 49% to 72% for that. We also used the CTC milestones and benchmarks tool, which is a fidelity monitoring tool on how well you're implementing CTC. And then we also documented any CTC protocol modifications and adaptations. So this describes our methods to study aim 3, which is the neighborhood social processes. And we did 2 different surveys, one at baseline and one at follow-up. At the baseline survey, we randomly sampled 2,000 addresses and selected 1 adult from each address to participate in the survey. Our response rate at baseline was 59%. And this first baseline survey we did door to door, and we had a recruiter, and then the participants either got a link and did it online themselves, or they used the recruiter's tablet. In our follow-up, we had COVID in between, so we ended up doing a mailed invitation survey instead. And so we had a bigger population initially, and we ended up with a adjusted response rate for this of 30%. The adjusted response rate accounts for the undeliverable invitations. And just a little bit more about what we're doing here in this study. I'm not going to have all the results for this one today, but we basically in both waves, we had 4 neighborhoods. So we had 2 intervention neighborhoods and 2 matched control comparison neighborhoods where we're looking at those social processes. And then this is our outcome evaluation methods for aim 4. And aim 4, as I said, is the outcome evaluation. And here we use t-tests of average violent arrest rates before and during the intervention and an interrupted time series design to compare youth arrests in 76 Denver neighborhoods overall to the 2 intervention neighborhoods. And then we also conducted an interrupted time series with synthetic control neighborhoods. So now I'm going to turn to our preliminary results, which is very fun. It's really fun to have these. Okay, so this is all referring to the aim 2 back to into the implementation results. So what did we actually implement, and what can we tell from that implementation process evaluation? So we implemented the Power of One in both neighborhoods since 2020, and that yeah, the media campaign officially went live July 2020. It's a little bit more delayed than we would have liked. We had 9 youth leaders and youth ambassadors that created the content. We had 4 million impressions on different social media venues, and we had 4 live events that that reached over 20. Well, actually, I have 4 in my notes and 5 on here. Okay, so that reached over 2250 people, and like I said, that's in both neighborhoods. And then we've got the positive recognition campaign. This took place in neighborhood A. The events took place in 2020 and 2021. We had them organized actually by 2 youth leaders from the Power of One. And over 100 people attended the events, and we recognized 50 different individuals for their positive contributions. And then, we've got the mini grants, and those started in 2018. These were done in neighborhood A. We funded 47 proposals, and we did that over 4 different rounds. So we gave 27 different organizations funding, and we reached over 6,600 people. We also hosted 3 grant writing workshops to really help the grantees build their capacity for grant writing. And we do know that they've raised at least $50,000 in additional funds. It may have been more now, but at our last check-in, that was the amount. And then here's the paths, community, social emotional learning, that we've done. That this program started in 2019. As I mentioned, we've served 3 elementary schools and 4 community organizations. We've reached over 1,500 youth, and in this program, we were able to also do some fidelity monitoring for the PAS curriculum. And we were only able to do that for a little while because of COVID. The program shut down in the schools, but we were able to keep the program virtual. But 90% of the teachers were were implementing PAS to fidelity. And then our final program strategy is the violence, injury, protection, and risk screen, the VIPERS. And in our treatment communities, we served over 2,100 youth were screened, 9% screened positive. And then of those that screened positive, 36% were referred for services. So I'm going to present our coalition survey results. And this again is still about AIM 2. So this is part of that, the process evaluation for communities that care. And the results on this slide are from both the community and key leader board members, and they're from those 3 different points in time. And so, except for one of the measures, we only have 2 points. But you can see we put up here the adoption of a science-based approach, and this is a really important measure in CTC. The adoption of coalitions to use a science-based approach is what CTC is seen is the key mechanism for the coalition functioning to get significant results. And so we developed a 10-item scale to measure this construct. We did not have that measure in 2018, but as you can see, there's high agreement in both neighborhoods that they did adopt that science-based approach. You also can see that there was high support in both neighborhoods for the social development strategy, which is also a really important component of CTC. And then this next slide shows strong coalition and key leader support for overall prevention. So we really had good buy-in in terms of supporting the big vision of what this project is. So here we highlight this is I'm going to switch aims to aim 3. So this is those results from that baseline community survey. And we're highlighting just a few of those results. We are still analyzing our post data. So we're just presenting right now the baseline. And these results really tell a compelling story about the neighborhoods. You can see from the results that in both communities, a low percentage of residents reported feeling safe and free from crime and violence in their neighborhood. And a relatively low percentage of residents agreed that there are adequate opportunities for youth engagement and leadership. But an overwhelming majority of the residents agreed that they are willing to respond to youth violence prevention by getting involved in reducing youth violence in their community. So there was really a high motivation to take action. And then, as I said, we will be analyzing our pre-post data to look at how those social processes changed over time using that pre-post quasi-experimental design. So I'm going to now turn it over to Dr. Arredondo Mattson to present our preliminary outcome data.
Thanks, Beverly. The next slides focus on aim 4 and the research question: did the combination of community and policy level strategies prevent or reduce violence in the intervention communities? This slide shows a comparison of average annual arrests per 100,000 for youth ages 10 to 24. We ran t-tests to compare the average rates for the 5 years prior to the intervention versus the average rates during the intervention within each community. As you can see, the average arrest rates increased in neighborhood A and the non-intervention neighborhoods from the pre-intervention period to the intervention period. You can see the percent change in the purple bar. It was a 34% change that was significant in neighborhood A and a 35% change in the non-intervention neighborhoods that was also significant. In neighborhood B, the average arrest rates were higher than both the neighborhood A and the non-intervention neighborhoods, and there was a 28% change for neighborhood B. That change was not significant, likely due to the fluctuation in the rates pre-intervention and during the intervention. This figure shows the trajectories of the annual arrest rates for youth in neighborhood A, B, and the combination of the other neighborhoods in Denver without intervention. As a reminder, the YVPC Denver was first implemented in 2011, as indicated by the gray vertical line. Our current implementation of YVPC Denver started in 2016, also noted by a gray vertical line. In 2011, neighborhood A served as the intervention community and neighborhood B was the comparison community. In our current project, neighborhoods A and B serve as the intervention communities. As you can see from the orange line, neighborhood B has dramatically increasing arrest rates in the pre-intervention years from 2013 to 2016, then a decreasing trend after 2016 during the intervention years. The purple line represents neighborhood A and has relatively stable arrest rates for both the pre and intervention years. The blue line shows the trajectory for all other neighborhoods in Denver and is generally increasing in the pre-intervention years and through 2018, then stable, then decreasing in the last few years. The takeaway from this slide is that arrest rates in neighborhood B improved during the intervention and rates appear stable for neighborhood A. Here we show the results of an interrupted time series analysis, which fits a regression line to the 5 years of pre-intervention data and another regression line to the 5 years of intervention data. The purple lines again represent neighborhood A. The slope in the pre-intervention years shown with the dotted purple line was slightly increasing, but not significant. The solid purple line shows a slightly decreasing trend in arrests after the start of the intervention, but was also not significant. In neighborhood B, on the other hand, arrests increased significantly in the pre-intervention years and decreased significantly in the intervention years. Moreover, the sizable decrease in arrests between 2016 and 2017 was also significant. In the non-intervention neighborhoods, the overall arrest increased significantly in the pre-intervention years and decreased significantly in the post-intervention years. However, there was not a significant change in the arrest rate between 2016 and 2017, and the decrease in the intervention years was not as pronounced as in neighborhood B. This graph uses a synthetic control neighborhood to represent the expected path of arrests in the intervention. This graph uses synthetic control neighborhood to represent the expected path of arrests if the intervention had not occurred. We use statistical procedures to create a synthetic control neighborhood based on information such as known predictors of crime and the arrest rates from the other neighborhoods in the pre-intervention period. Here we use the natural log of arrests rather than arrest rates. The synthetic control neighborhood very closely aligns with neighborhood A in the pre-intervention years between 2012 and 2016, and then the two trajectories look different in the intervention years. Arrests in both the intervention and control neighborhoods increased in 2017 and 2018, with higher rates in the synthetic control neighborhood than in the neighborhood A. In 2018, the rates diverged with a dramatic decline in the control neighborhood. Neighborhood A, on the other hand, had a steady decline in arrests after 2019. In the 2 years of COVID, the intervention and synthetic control neighborhoods look very similar. The takeaway for this slide is that there are no significant differences in the rates for neighborhood A and the control neighborhood. Similar to the previous graph, the control neighborhood is closely aligned to the intervention neighborhood B in the pre-intervention years, and then the trajectories look different in the intervention years. The arrest rate shows a substantial amount of fluctuation in neighborhood B during the intervention years, and the rates are consistently lower than in the control neighborhood. The takeaway from this slide is that during the intervention years, the rates are consistently lower in neighborhood B than in the control neighborhood. Next slide. This graph shows the interrupted time series analyses with the estimated fitted regression lines before and during the intervention for neighborhood A versus the control neighborhood. This method is designed to test for differences in the intercepts and slopes during the intervention period, yearly arrest data from 2017 to 2021. Consistent with previous graphs, this graph shows a gradual increase in arrest rates during the pre-intervention years, and then arrests in both the intervention and control neighborhood decrease slightly, with the synthetic control neighborhood having slightly lower rates. No significant differences in the rates of youth violence or the rate of change were detected. It's important to note that we're hoping to gather 10 more years of data from 2001 to 2011 to compare to the arrest rates from 2012 to 2021 in neighborhood A. This will allow us to compare neighborhood A's pre-intervention years to the 10 intervention years. The takeaway for this slide is that there are no significant differences in rates for neighborhood A and the control. Consistent with other graphs, this graph shows increasing arrest rates in the pre-intervention period for neighborhood B and the control, then decreasing arrest rates in neighborhood B and the control. The arrests were significantly lower in neighborhood B than the control neighborhood during the intervention period. However, there's no difference in the rate of change between the intervention and control neighborhood. The takeaway for this slide is that rates were significantly lower for neighborhood B. Based on the current analyses, we have three main findings. There are no significant differences in arrest rates for neighborhood A and the control neighborhood. In neighborhood B, arrest rates were significantly lower compared to the control neighborhood during the intervention period. And the rate of change was not significantly different between the intervention and control neighborhood. Two analytic approaches confirm the strong implementation effects in neighborhood B. And as I stated before, we're still encouraged by the lack of increase in arrest rates in neighborhood A, and more analyses will be conducted to determine if there are intervention effects that can be detected in the 10 years prior to the intervention compared to the 10-year intervention period. Now I will turn it back over to Dr. Kingston.
All right, thanks, Sabrina. Okay, so now I'm going to present on our implementation challenges. So as I had mentioned, COVID impacted all of our implementation and evaluation process, but we like many other research projects found ways to adjust. It affected Power of One. The violence risk screening initially was quite problematic because people, if you remember early on, weren't going to health appointments. So that we weren't doing screening, and the PADS program was all in person in school, and that needed, had to get shut down initially. It also impacted the community evaluation, where we ended up going to a mail evaluation, mail invitation survey instead. And it was also somewhat challenging in terms of our coalitions because, for those years we did everything virtual. I mean, we were able to adapt, and we did have pretty good turnout in our coalition meetings, but it was challenging to bring on new coalition members and partners. So in community A, there's also was some conflict and some challenges with that coalition. There's been a huge growth in the number of nonprofits in community A or neighborhood A, and many new people were coming together, and there were just some conflicts that in personalities that impacted the functioning of that coalition. And then, as I mentioned too, we had some implementation delays in launching the Power of One campaign. So it got started late, and it likely did not have the impact we believe it could have. But the good news is we got it off the ground, and the city of Denver was very excited about it. And we are now in our third Youth Violence Prevention Center Denver project, and the Power of One is a big part of our project in this new one. So even though we didn't get it all the way launched in that last round, we're going to be doing that, or are in the process of doing that in the project. And then this next slide talks about our study limitations. And so one of the major limitations is that we are only able to use arrest data to test our outcomes. And we had to use arrest first because that was our only way of getting data on youth violence. And ideally we would have also had self-report data like we did in our first round, but we couldn't afford to do with the budget that we had to do the community survey, which is collecting that information on neighborhood social processes, and a household outcome survey. There just wasn't enough resources for it. So we did have to, have that limitation. And that was why. And then we do know that there was a short length of time for the full implementation of the interventions. And, what we learned in this is that these interventions, even evidence-based intervention that's already been tested and tried out, is hard to implement. But these were interventions that were basically designed. A lot of these interventions were designed and developed by the communities. So that definitely took more time. As Sabrina mentioned, neighborhood A is in its second phase of intervention, and these current analyses don't account for that. So we are going to be doing further analyses, like Sabrina said, about that. And we also recognize that other factors may have influenced the study outcomes, things like gentrification, the protests and civil unrest. And so we are going to do some analyses to see if we can control for some of those other effects. And the way this study is designed, we're not able to tease out which interventions impacted the outcomes. So we, it's just a limitation of what we're looking at overall community effects. But I'll say in our new study, it is a different design, and we are going to be able to tease out some of those effects. So that's kind of exciting, but this is a limitation of this one. And then I'm just going to go through some of our preliminary conclusions. And this is something that this first one is something that I've kind of been seeing and been doing this community work for a while, and that it really may be more difficult to have a strong impact in the larger, more populated geographic region of neighborhood A. So, we're seeing the effects in neighborhood B. It's just a tighter community and easier to get saturation of programs. And as I mentioned already, the second bullet is that these programs, that are community developed and not dissemination ready, takes more time, definitely takes more time. And so that's just something that we're learning and aware of. And we do think that, coalition functioning is likely to have impacted some of the program implementation and outcomes. And so, we're pretty excited about the strong implementation of that community level social emotional learning program. And it does seem potentially promising and suggests further studies. Some of our youth who participated in that program, they were getting so bombarded with social emotional learning messages from adults in different contexts, like at school and in the Boys and Girls Club and in all these different programs that were taking place in that neighborhood, that they actually told us they were kind of sick of it. So at least for some youth there was like some saturation. So that's pretty powerful that actually happened. And then this is kind of our overall preliminary conclusion, to kind of go back to the first, what is CDC wanting to learn here about community level violence prevention, that it may be effective in preventing violence. We are seeing some promising results, but we have much more to learn. So now we'd love to open it up for questions.
Thank you both so much for that presentation. Amazing to hear about all the work you did and during a very challenging time to be working with communities and schools and healthcare providers. Yeah, I would love to invite our participants. If you have questions, you could either raise your hand or type your question into the chat. And while they're doing that, I have a question for you all. Like, what advice would you provide to another community that's concerned about violence rates among their youth and wants to take some action? What would you recommend for them based on what you've learned here?
That's a great question. And I mean, I really do recommend using the communities that care process. And in Colorado, we are very fortunate to have state funding for communities that care in many of the counties across the state. So, if they're in Colorado or outside of Colorado, I just think it's a great community planning process that uses a public health approach, and it helps organize all the different possibilities of what communities could be doing or think about. I love communities that care because it's data driven, so they're looking at their data. They're setting priorities, so you're not trying to do everything at once. You're looking at what are the risk and protective factors we most want to address, and then they're creating a tailored community action plan based on their unique needs, what they are prioritizing and what they're wanting to do. And that action plan can then be strategies that they believe are feasible and a good fit for their community. So I do well, and then I'm going to keep going the phases. They're also, you create that plan, you implement the plan, and then you also are continuously evaluating is what we're doing working? Is this the right thing to be doing? And so just that planning process is just so powerful. And also like having a plan that everybody buys into, it's just like a laser focus. So if you know, I've watched this, you know, in our communities, the communities come together and create this plan. It builds relationships. They're taking action. It's not a plan that just sits on a shelf. It's tailored to their needs. It builds community capacity. It's the idea to be sustainable. So I am a big fan of the communities that care. So I would, and I, you know, your center just happens to have a great resource all around that. And I would say that's a great tool. I don't know, Sabrina, do you have anything else to add?
No.
Okay, great, thanks. Let's go to a question from Ching Lee. You're on mute.
Yes. Thank you. I was reading another question about the young violent young arrest rate. So how did you operationalize this measure? Another potential measure in my dissertation, I used neighborhood violent crime rate, which include the measurements from uniform crime report data, including murder, rape, robbery, aggregate assault, and domestic assault. So is it possible to have those measured in the two communities you have? Thank you for the great talk.
Yeah, we used the typical violent arrest rates because that was our research question. We wanted to know if violence decreased. So that it is a combination of aggregated assaults, homicide, all the typical ones that you would measure in violent arrest rates. We did not include nonviolent arrests in the measures. And the second question that was in the chat is whether we have presented the data back to the community. And we have not. We are in the process of compiling all the results from the social processes survey and having all the data together in one place before we provide it back to the community. But we definitely are planning to do that and would love to hear their reactions and insights.
Yeah, and also just to add to that, if you all have any suggestions about presenting that data back to the community, if you've had success around that, this is like the slides Sabrina presented are so complicated, and we're trying to think about how to best do that. And we also haven't done the community social process stuff measures pre-post, so we want to really like have the full story together. So we're getting more and more of it, but we just don't have quite all the pieces. And so yeah, we're one of the reasons we wanted to present, we're excited about the opportunity to present here, is to just, in case we got some feedback from you all about suggestions for that. And we're very intentional to keep the preliminary results on this, because we do really want to present this to the community and let them weigh in before it goes really too far anywhere. That's a very high priority for us.
Yeah, thanks for that. I think especially given those differences by neighborhood, it'll be so interesting to see how the community sort of helps interpret it and understand what might be driving some of those differences that you found. If others here wanted to share their ideas or experiences with sharing data back with community, or if you have other questions, feel free to raise your hand, put them in the chat. I was curious, you mentioned all the other communities that care happening. To what extent are these different efforts connected? Are they sort of sharing lessons learned in real time so that different communities can be learning from each other? Can you talk a little bit about that piece?
I'm not as up on kind of what is exactly happening in Colorado, but I would think that there is some of that stuff going on in terms of sharing across coalitions. For our project, 3 of the sites used 3 of those 5 used communities that care in that last round of funding, the 2016 to 2021, and the other 2 areas, one's in Virginia and the other is in Chicago. So we all implemented communities that care in urban settings, which it's not always, it doesn't have as much published knowledge in communities that care in urban settings. So we're putting together a paper about our lessons learned across using CTC in urban settings, and what we found in our sites. And so we're just in the process of putting that together right now. But that would be, so I think it's kind of happening. I'm not sure how organized it is. The communities that care site could also be a good one to check in with. They've got, really good consultants to work with, and I'm sure would be very responsive. And also, I think probably some of the staff at your center as well, could probably answer some of that if people needed to get in touch.
Awesome, thanks. One thing I noticed in your data is around the screening, the violence intervention screening. And I think it was 36% of people who screened positive got referred to services. And I was wondering if you could drill down at all. Like, did you have a target for that? Was it higher than 36%? Are there sort of enough services with capacity to receive those positive screens? Like, you mentioned COVID may have been part of the challenge with that, but I wonder, if the screening is happening, but then the referrals are not happening, like how that process kind of looks if you get more granular with it.
Yeah. Oh, sorry. I don't mean to do that. Okay. So I'm not sure if Dr. Siegel is on this call today. He's not on. And so Sabrina, do you have that information? Because I don't have that offhand.
I don't think so. I think this was, we were only gathering process measures, and it started off really well, and then it was, hijacked by COVID. And so it was just kind of a problem in the end.
Okay, well, thank you. Yeah, it just caught my eye because I thought that might be kind of a piece of that puzzle. We have a question from Akila. CTC uses risk and protective factors based on unweighted demographic data. How well do the demographics of this evidence base match the selected neighborhoods?
Okay, so I think, let me just make sure I'm understanding. So what the data that we used was, we didn't use in order to for the communities to select their risk and protective factors. We didn't use the CTC survey that's traditionally done in the schools. We actually created our own survey that was a community household survey. So we actually do have we actually did look at how did our demographic data in the data that we collected match the population of the community. So we looked at that compared to census data. I don't know, I don't remember exactly all the details of that off the top of my head, but I certainly could share some of that with you if you wanted to follow up. That was, we did a final report on that first project, and so all that was written in there. I think if I'm remembering, I shouldn't say, I feel like it was pretty good, but maybe not exactly perfect match. But I'm not sure. Is that the question? Did I get the question right?
Yeah, thank you for referring back to that. I think, whenever I hear evidence-based practices sort of implemented on a community level, making sure that the evidence-based is accurate to the population and not on dead old white men, but on the young children who are actively engaging and living in those communities. And so on the CTC website, right, the risk and protective factors were based on that information. So really just how are you making sure that these are accurate and appropriate tools for the community to choose from?
Thanks.
Yeah, that's a great point, Akila. And I see Sabrina put in the chat a little more about the measures that were used. As part of the follow-up for this, if our speakers have any of those resources or reports that you want me to link to, we can certainly share that with folks, or I think everyone could reach out if you'd like some more information. Oh, good, I see contact information is showing here. So if you'd like more details on any of this, you could certainly connect. I'll pause and see if there are any last questions. Oh, I see Ching has her hand up.
Yeah, I want to congratulate for your important work for Colorado, for communities around. So among those 5 founded Young Violence Prevention Center, I wonder if there's something we learned from other center or we have been doing here in Colorado in terms of the early warning signs. For example, the Taliban shooter's mother, Sue Clanbone, didn't notice her son's depression, didn't check the bedroom, the tape he practiced about the shooting, which she missed. She only mentioned this many years later. So I wonder, another pair of shooters in Colorado in 2019, were any early warning signs we missed? Did the community-based intervention strategies here in 2 communities, do we include some type of training on those early warning signs? Do we really have some data to measure gun violence related outcomes here?
Yeah, that's a great question. And this project wasn't necessarily focused on that strategy. So, but our current project that we have is looking at that a little bit more and is looking at how the community can promote those, the community can come together and promote those warning signs and help to connect youth and families to resources. So there's a new project is doing that, but this one wasn't quite part of the project in the way that you're describing. I mean, I think the violence risk screening kind of comes a little bit close to that, that tool is helping to identify those who could be at risk for future violence and then trying to get them the supports. But we weren't quite doing like what you're talking about of promoting those warning signs, but what you're saying is really important and needed in community work. Sabrina, do you want to add to that?
I don't have anything else to add.
Okay, then come back to my previous question about operational definition about young arrest rate. So would the data come from Uniform Crime Report data?
They come from the Denver Police Department.
Right. That's
And
uniform.
yes, and they compile them in the way that needs to be compiled for the uniform crime.
Right. So which means you use the age cut-off point, right? Which you measure as young arrest rate. So which age range you use for young definition?
10 to 24.
Okay. So those include murder, rape, and arrest, aggregate arrest for those counts from 10 to 24.
Yes, for murder, non-negligent manslaughter, robbery, aggravated assault, and rape.
Yeah. So thank you for clarifying that, because that's a nice data source available there. Hopefully we can make good use of this data source to measure those population-based interventions. Thank you.
Well, thank you very much. Thanks to everyone for the questions and the discussion. And I really want to thank our speakers for being here today and sharing your early results with us. Super exciting to hear about the work that's been happening and what you're learning from this project. So thank you all. Join us again in September for the next webinar in our series, and feel free to reach out to our speakers today if you'd like more information. Okay, have a good day.
Bye.
Thank you. Bye.